Do I need to use a topical medication while I'm taking Accutane? That's the question that we're going to answer today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice that only treats acne. And we like to bring our insights and experiences to acne sufferers who are trying to navigate the path toward clear skin. And we hope you find this useful. However, this is not meant to be medical advice. This is only for educational value. So the question often comes up in my practice. Patients want to know, do I need to use a topical medicine while I'm taking Accutane? Do I need to apply a cream, a lotion, a gel, a prescription product, something while I'm taking Accutane to help my acne improve as well? And I can tell you what we do in our practice. So in our practice, the answer is when you use Accutane, the skin becomes very sensitive and very dry. And that's almost universal. In almost every patient, they experience the same thing. And the last thing we want to do is to use anything more harsh on the skin while they're on Accutane treatment. So Accutane is the medicine that's doing all the heavy lifting. Accutane is the thing that is making acne better. We don't look to the outside for other factors that are going to contribute to that. We use Accutane for that purpose. If there was another medicine that was going to be effective, then we would use that instead of using Accutane just by using a topical medicine. But in fact, we're using Accutane because it's the most effective option in that particular circumstance. And so we don't encourage our patients to use anything other than that while they're under treatment. The only thing that we do encourage them to use are skincare products that are very hydrating, very gentle. So we always recommend moisturizers that are safe for acne, that are oil-free, that are very effective in hydrating the skin, and we recommend using those very liberally, to use them often to keep the skin well hydrated while on Accutane, because that reduces a lot of the irritation and sensitivity of the skin during treatment. We also encourage using moisturizers on the lip, lip balms, and other products to keep the lips from becoming very dry, because the lips can become excessively dry and very uncomfortable in some patients if they're not moisturized. So we encourage the use of a moisturizer for the lips as well. We also encourage the use of a sunblock, an acne-safe sunblock that has all of the right protection to give good protection from the sun, and moisturizer that helps the skin also from a hydration standpoint. So those are the things that we like to use. And when it comes to a cleanser, for example, we advocate using cleansers that have very gentle cleansing ingredients. We don't like aggressive cleansers that strip out all of the remaining oils, because remember, Accutane works by reducing the oil production in the oil glands. So your skin is already dry and already is deficient in a lot of oil production. So the last thing we want to do is to use a cleanser that's very harsh and starting to remove even whatever residual oil is present. So those are the things that we like to do. But we do not like to use harsh medicated products that contain ingredients that cause the skin to become more sensitive. We talked about this in a prior episode, where we avoid things like laser treatments and chemical peels and waxing. All of these things are not allowed while you're on Accutane because your skin is just too sensitive. And the same thing applies to topical medicines, because many of the acne medicines that are topical have ingredients that are somewhat harsh on the skin, and they make the skin more dry and more irritated. And we want to avoid those very, very much in our practice. So we counsel our patients against using those. So we focus only on hydration. Everything should be very gentle. And Accutane is the medicine that's doing the work. And we don't rely on other outside topical medicines to contribute to that.